You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, new treatment options for people with periodontal disease or gum disease, bleeding gums, bad breath, loose teeth. We're talking about laser therapy. With us, we have an expert on this topic. He's been using this laser to wipe out gum disease for quite some time. We have Dr. Janssen. Welcome to the program.
Thank you, Randy. Glad to be here.
Now, before we get into today's topic, and I have lots of questions for you, who's your typical patient, and what are the different services you offer? Because you do more than just laser dentistry.
Absolutely. I offer everything that most dentists offer, crowns, root canals, extraction of teeth, dentures and such, but I also do a number of niche procedures. The big one is sedation dentistry for people that have a great fear of dentistry. They have years of dentistry that is piled up and has been unaddressed. And the other segment is people that are busy and they don't have a lot of time. They have children, they're constantly on the go. And so if you've got dentistry that's going to take 15 or 20 appointments, it's like, whoa, I can't do that. Yeah. But if I can do that all in one appointment, which I do.
So sedation's popular.
Absolutely.
Is that right? Really?
Absolutely. I do probably 1 or 2 sedations every single day. The other thing that we do in our practice is called LANAP, which is a procedure to address people's gum disease issues, which is rampant in this country. 75% of Americans have some sort of periodontal disease, and that's the subject of today. Another procedure that is done is called night lace. It's to help people. It's a procedure that's done to treat snoring and sleep apnea. Currently, what we have is to treat those two entities, you either wear a CPAP mask, which is rather uncomfortable, or you wear an oral appliances, which is like 2 mouth guards hooked together. With the night lace procedure, what we're doing is using a laser, we're reinforcing the walls of the throat so they don't vibrate.
So snoring goes away?
Snoring goes away, Randy, yes. So instead of spending a night on the couch, you stay in your own bed. When you're out at the cabin hunting and such, people aren't complaining about you in the morning. So anyhow, that's been great. I've had it done myself, and it has made, I can stay in bed. I don't have to, my wife doesn't kick me out.
And the snoring is gone?
Yes, yes indeed.
Wow.
Yeah. And another procedure that is new and is evolving is referred to as PST. It stands for Pinhole Surgical Technique, and it is used to treat gum recession. People have exposed root surfaces. Their gums have receded. It's unsightly, particularly if it's on your front teeth. It's also, you're subject to hot and cold sensitivity. So with this procedure, it's very similar.
So the cold sensitivity from the receded gums, this takes care of that? Yes,
it will go away because you brought the gum tissue down now to cover those nerve endings that were previously exposed. And it's done arthroscopically. Basically, you're just making a small hole, going in with special instrumentation. You're bringing that gum tissue down to cover those root surfaces. It is really neat stuff. The way this procedure is normally done, or this is an alternative to the procedure that most periodontists do, and that's called a tissue grafting procedure, where a piece of tissue is harvested from the roof of your mouth and transplanted to the site.
To cover up that receded
To cover up that receded area.
Yeah, but it works, that type of surgery, right? To eliminate cold sensitivity.
Absolutely, it works. The drawback is that you'd have to harvest a tremendous amount of tissue from the roof of the mouth, and that those mouth areas are tremendously painful. My technique looks like, instead of having corrugated cardboard lining your gum area, mine looks like pristine natural tissue, like we never did anything. And my technique is virtually painless in the aftermath, in the recovery. My patients don't have to take narcotic pain pills and such. Typically, a couple ibuprofen or some acetaminophen gets the job done just fine.
So, and how soon does the cold sensitivity go away?
Immediately. It's gone immediately. I had a fella in, let me tell you a story. I had a fella in that drove 2.5 hours to see me. And he had areas where there was a lot of recession, and it was on some of his front teeth. And so because of that, not only did he have the sensitivity, but he didn't like to smile because it was ugly looking. And so I went ahead and we did the procedure, and one of the rules is we don't peek and we don't pull the lip during the healing time. But anyhow, I was back in the office and my staff wanted to get a couple pictures. And so my staff Ashley says, well, I'm violating the rules here a little bit, but I just want to pull back the lip so I can get a picture of the most problematic areas. And she showed him the picture, and he said, that's me? I can't believe that. And she says, you were following my directions, Wally. Awesome. Meaning that he hadn't, been pulling the lip back and looking and such. And the procedure is virtually painless.
So they don't complain about pain?
No. That's it. There's some swelling, which is controlled by placing ice on the face and such, but I haven't had a person yet that has had significant pain.
Now, let's moving on to today's topic, gum disease, periodontal disease. Is that the same thing, by the way, gum disease, periodontal disease?
Absolutely, yep.
So what defines it, and what are the current treatment options? Because I guess you treat it differently than the standard way.
Absolutely. Periodontal disease is a bacterial infection of the gums, connective tissue, and the bone surrounding or holding your tooth in place. As I had said before, it is, there's about 75% of the population that is affected by some degree of periodontal disease. It's the most common chronic disease in the country.
It's how people lose their teeth?
Absolutely.
What are the symptoms? I mean, how do you know if you have it? What are the obvious symptoms?
The obvious symptoms are bleeding. Bleeding is where it all starts. And bleeding gums over a period of years and years, not being addressed, not getting it back to pristine, healthy tissue. Eventually, it's a progressive, painless progressive process that is typically painless until you get in the late innings. When it's too late, it hurts.
Yeah, but if you're flossing, a little bit of blood's okay?
No.
Really?
Absolutely not.
Even when you're flossing?
No. If I had a situation where where you had an area on your hand or your arm or your leg and it bled every day, you'd be in to see your doctor, Randy.
Okay.
You wouldn't say, well, it's just a little bit. You would have that taken care of. If you have bleeding gums, Randy, you have an infection. Gums that are healthy do not bleed.
So that's the first common thing. What's another symptom?
Other symptoms of periodontal disease include, you'll have puffy gums, bleedy gums, as we talked about.
Puffy red gums?
Yes.
Okay.
Yeah, just a very unnatural look. You'll see they're red, they're bleeding, they almost jump out at you. And the red puffy gums, that's an easy one to take care of with the laser.
Okay.
Other symptoms, people that, let's say your teeth were all straight, there were no spaces between the teeth, and all of a sudden there's a space that appears. And the tooth is migrating. One is a little longer than the other. It's a little more forward. You'll get migration of teeth.
So teeth that are moving.
Teeth that will move, and spaces that will develop in areas where there were not spaces before.
And how does the infection have anything to do with this?
It creates, it's basically the infectious activity is pushing the tooth out of the socket. It's elevating, it's moving it. Very common, but it doesn't hurt. And so a lot of people, because it doesn't hurt, well, it's not a big deal, is it? And it's like,
is that what guys do? They wait until it hurts before you go to the
Guys are
dentist?
the worst. Guys are the worst at waiting until they're almost on their deathbed before they'll go in to have, whether it's a chest pain or a tooth-related issue. Many of the people that I see, there's a significant other that's right behind them, gently propelling them or accompanying them actually to the initial examination.
Now in your town, I guess you've been doing television advertising on sedation for many years.
Yes, I have. Over 10 years, trying to get the word out to fearful individuals, people that haven't been to the dentist for a long time, and also people are busy today. They have busy schedules, so if you've got a lot of dentistry to be done and either you have fear of dentistry or you have time constraints, sedation is absolutely wonderful because I can get most people done in 1 or 2 visits.
Now, is this true? Because, you know, I haven't had IV sedation. But some people go in, right? And as you say, you can get a lot of stuff that normally would take you 4 or 5 appointments. Get it all done in one day. But after the sedation, they don't even remember that they had anything done sometimes?
Yeah,
is
absolutely.
That true?
Yeah. I can tell you a story. There's many stories, but I'll give you an example. A patient comes in, and it's not uncommon for me to see a patient, they'll show up at 7 a.m. and they'll leave at 5 p.m. Or the record is starting at 7 a.m. and I got done at 9:30 p.m. Because the patient said, I said, are you good? Because I'm good. And they said, go for it, let's get this done. So we got it all done. That individual, I did everything. I did root canals, I did crowns, I took out teeth, I did LANAP, a periodontal procedure. We did a whole bunch of things in that single appointment. He walked in and his teeth were in disarray. He wouldn't smile. It was an ugly smile. And when he walked out, he doesn't remember this because he was still sedated, but he was all smiling and showed his wife started crying. Nice. He looked in the mirror and he was totally elated. The next day, when the staff talked to him, he said, well, his wife played a joke on him. The next morning, or later that evening, when he was kind of getting his marbles back, his wife says, well, Randy, get ready, we've got to go see the dentist. And the guy says, okay, I'm ready, let's go. And she said, sit down, we were there already, dummy. And so that's very commonplace where there's little to no memory of the appointment. And I guess my thought is if you're having a colonoscopy or something that's invasive done, I don't want to be party to that. There's certain things I don't need to know. And sedation gives individuals an avenue. Absolutely. I have treated, I don't know what the count is, but thousands of people without incident.
Because the blood pressure's low or monitored, all of that stuff's looked at during the procedure.
Everything is monitored. Incidentally, we just got done with what's called an advanced cardiac life support, a training with the entire staff. Not that, and I hope I never have to use it. Most likely, where I'm going to end up using it is outside the dental office. Someplace where there's family and friends in a gathering where hopefully we're going to save a life. But the whole team is on board, so it's probably not the person in the chair that we have to worry about. It's probably the companion that brought them that's out in the reception room that'll have the heart attack. And if that happens, my staff and I, we're ready to go.
We're prepared. Good.
We're ready to go.
Gum disease. Let's talk about it because we talked about no more bleeding gums, bad breath, loose teeth. Teeth are starting to flare. Number one way, according to you, people lose their teeth is gum disease, bacterial infection.
Absolutely.
Now there's 2 ways to do it. One is kind of like cutting it out, and one is with the laser. So tell me about the 2 options for people watching this that have those symptoms.
There's 2 methods. One that I was taught in dental school, which involves using a scalpel, where you're basically cutting the tissue, peeling the tissue back off the teeth and the bone, scraping the teeth, amputating, removing the diseased tissue, bringing the tissue back, and then suturing it up. The issue with that method, it works, it gets rid of the infection, but the problem that I see that is not part of the issue with the new technique, you've got exposed root surfaces and that are unsightly. You also have cold sensitivity because those root surfaces are exposed. They have nerve endings that come to the surface. You throw something hot or cold on there and you've got a problem. Also, you've got dark triangles between the teeth. So on the back teeth,
cut out some of the
tissue was amputated to get rid of the disease. Now, the other part about the surgical procedure is that it's quite painful. Typically, narcotic analgesics are prescribed for that. And the big issue is most of the time, periodontists will only want to do one sector at a time. The problem is
one side of the mouth.
One side of the mouth. And so the problem is if you encounter so much trouble with one area, you just absolutely dread going back to have the other sectors done. And so either you do them unwillingly or you back out of it. The other issue with the surgical technique is you're not getting all of the bacteria or the disease entities out of there. Okay, with my technique, what I'm doing is I'm using a laser. I'm not using an incision where I'm peeling back the gum tissue. What I'm doing is making a paper-thin entryway between the tooth and the gum tissue. I love gum tissue. I don't want it destroyed because that gum tissue I want it to stay right where it is, and I want to get healing from inside out. And I want that tissue to reattach to that tooth structure. So what I'm doing is that with the laser, I'm going down and removing or hitting the bad bugs and subsequently going in there and cleaning that root surface. But we create an environment where then the body can get the upper hand, reattach the tissue to that tooth. And the beauty of it is that I don't create root sensitivity. I don't have unsightly tooth structure showing. I haven't created dark triangles between the teeth, which now act as catches for food debris. And so the person says, well, doctor, you cured my gum disease or took care of that, but I can't smile anymore. Look at these dark triangles.
That's with the older technique of the cutting.
Correct.
Is that a common, by the way, are a lot of people going in like where you are? Let's say the whole state, right, where you are. Would you say 500, 1,000 of these procedures every single day are being done the old way, which is cutting it out?
Thousands of procedures are being done every single day where we cut out the diseased tissue.
When it could be done with, you just go around the mouth with a laser.
It could be done with the laser.
So the gum specialist, the periodontist, what do they say about this laser?
They love it. The top people in the periodontics community are gravitating towards this procedure.
Okay. What about your town? Not so much?
No, I'm the only one that's doing it in my town. The issue that you have is people get comfortable, periodontists or general dentists, whoever, that you get comfortable doing things a certain way. And many times that can be your greatest impediment to moving ahead to something new because you say, well, it works. I've always done it this way. I've always been one to look at things and say, is there a better way that this could be done? Is there a better way to do it such that there's less downtime, less discomfort, a better outcome? And
we're going to take a quick break. We come back. More about the process. So no more. And how soon does the bleeding go away? Like from flossing and things like that?
Virtually immediately.
Is that right? Okay, we're going to take a quick break. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
I'm Dr. Craig Janssen. I've treated hundreds of fearful patients using sedation dentistry without lecture or judgment.
Dr. Janssen has cured my fear of the dentist. Sedation dentistry allowed me to get all my work done in one visit.
If going to the dentist is one of your greatest fears, sedation dentistry is right for you.
Dr. Janssen made me feel more comfortable to take the step to come back in.
Whether it's been a couple years or 20 years since you've been to the dentist, here at Janssen Dental, we're ready to help you. We'll give you something to smile about.
You're watching The Wellness Hour. I'm Randy Alvarez. Today's topic, using the new FDA-approved laser, this LANAP protocol, to eliminate gum disease. Bleeding gums, bad breath, loose teeth. According to my first guest, he says this is the #1 way people lose their teeth. Is that right? Welcome back to the program.
Well, thank you. Absolutely. It's the #1 cause of tooth loss, not only in this country, but worldwide. The other thing about treating this bacterial infection with the laser is that you're going to have more energy. You're going to feel better. You're going to be a healthier individual.
Why?
Well, there's a tremendous amount of evidence that has been in the works and is evolving that show a link between periodontal disease and increased risk of heart attack, stroke, and an exacerbation of diabetes. Diabetes actually promotes periodontal disease, and periodontal disease promotes diabetes. So it's a double-edged sword there. And another thing I want to mention is that when you take care of this bacterial infection, you just feel better. You have more energy. You're healthier, less prone to colds, flus.
Because your body is fighting this infection.
Yeah, you're directing resources towards fighting something that I can take care of when those resources could be allocated elsewhere.
Now, the people with bad breath associated with gum disease, why the bad breath? And why does it go away after you do the laser?
The bad breath, Randy, is associated, the bacteria that are responsible for periodontal disease, gum infection, a byproduct of their metabolism is what's called a volatile sulfur compound. Basically, it's the best thing that you can equate it to is like a rotten egg, or almost like a poopy smell. Wow. I can pick it up in a heartbeat when I walk in a room. And that goes away with the laser? Yes, it is gone. The transformation is absolutely astounding. And what'll happen, let me tell you a story. Okay. You know, many times it's a woman that's pushing the guy in to have this done, and she'll say, oh, his breath is terrible, I just can't stand it. And she's the happiest person in the world when you take that away, when you correct that problem. But the breath issue changes immediately. It's absolutely astounding. Now, you say using this laser can change people's lives. Absolutely. I had this one guy, Randy, who he knew his breath was bad. And so when he talked to people, it was always like this. He was always kept a distance. He didn't like to smile because the gums were red, puffy. There was debris and stain. They were ugly. It was not a good smile. So we took the laser. We went around his mouth. We took care of his infection. He was back a few weeks later, and his wife on the side says, you don't know how this has changed him. I said, oh yeah, I do, because I saw him walk in today. He smiled. All of that inhibition that was previously present was gone. Nice. And of course he was interacting with my staff people, and they were joking and stuff. And when he first came in, there was no communication whatsoever. So he was very socially withdrawn, embarrassed, inhibited, and he really didn't want to be there. And he kind of shunned interaction. And his wife said, this is awesome. I can actually kiss him again and enjoy it, because she wasn't liking what she was encountering before. She thought it was disgusting and gross. So anyhow, it changed their life. And so maybe it saved a marriage. You do this every day? I mean, you use the laser every day for gum disease, treating gum disease? I don't think there's a day that goes by, Randy, where I don't do at least one case. And incidentally, when I do a case, I do the whole mouth. I don't do it in sectors. I do the whole mouth at one appointment. And it's... So they walk out with the cleanest gums in town? Absolutely. Absolutely. Now, for people with, you know, their teeth, they hurt or they're loose, how does this laser make the teeth stronger? That's the part I'm not getting. Well, what you have, Randy, is when you have this bacterial infection, the gum tissue is separating from the teeth, and you've got all this debris and gook down in there. When you go in with the laser, you get rid of all that, and you create an environment that the tissue can just regravitate and reconnect to the tooth structure. Interesting. Okay, you brought a clip of this laser. What are we about to look at? What we're going to look at here is an animation. We're going to look at an animation from the manufacturer that shows the laser being used and how it is vaporizing the diseased tissue and the bacteria, of course, which you can't see, but that is occurring. Okay, good. Let's take a look.
The fiber optic tip is gently placed at the top of the periodontal pocket to begin removal of diseased tissue that lines the pocket. The Periolase laser is designed to target and eliminate selectively only the diseased tissue and germs, dissolving toxins and leaving the healthy tissue unharmed. The laser tip is then removed from the pocket and set aside. In the next step of the procedure, ultrasonic cleaners as small as a laser fiber tip are used to remove the hard deposits we call tartar or calculus from the top of the teeth and roots. Then the laser is used again at the bottom of the pocket to remove any remaining diseased tissue. This pass of the laser also sterilizes the tissue and bone and completely eliminates the bad bacteria, germs, and toxins. It also stimulates the formation of a blood clot, which once formed contains fibers that reattach your tissue to the tooth surface and seal out debris and bacteria like stitches would, and creates the right environment to cause the bone and other soft tissues lost from the disease to grow back.
Very nice. So it looks easy.
It took a long time to learn. A lot of training and a lot of practice.
Is this the future of dentistry?
Absolutely.
Like in 30 years, everybody might use a laser to clean this up?
Hopefully a lot quicker than that. I would hope that with shows like yours that we can spread the word, and within 10 years I'd like to see this be mainstream.
So if somebody has the bacterial infection, you can't really brush and floss it out. I think that's what you told me on the phone. Yeah. Brushing and flossing, you can't get down in there. You cannot get down in there. It's like a hole. And you think you're going to scrub the top and somehow that's going to solve your problem. It isn't. You need
a dentist to be able to get down in there and do the dirty work, which you can't do.
You know, another thing that I had to ask you is that you said on the phone that people that maybe 15 years ago you would have extracted their teeth, you're able to save teeth now.
Absolutely, absolutely. Utilizing the laser, I can prevent tooth loss. And when you lose a tooth, particularly if it's a front tooth, it's a huge deal. It's like, what are we going to do now? It's expensive. It's humiliating. I've had people that have begged me. They said, when you tell people that they may lose their teeth, some people, they start crying. And it's like, whoa, wait a minute. There is another option. You know, rather than taking them all, I do have another option for you. I have had, if I could tell just a quick story.
Sure. We've got about a minute.
I had a woman, this was back in 2006 when I was just starting to use the laser, and I had a person that came in that had very significant teeth that were moving, and while I was treating, I literally had to hold the tooth in place to get the debris off of it, and I was like, Craig, you've got to be crazy. This is never going to work.
Because you're trying to save the tooth with the laser.
Yes.
Okay.
But I didn't think it would work. Well, we're now 11 years later. And guess what, Randy? Those teeth are still there. They're tight. The lady is happy. She's so thankful that she didn't lose her teeth.
Is that right?
And that was one of the worst cases that I've ever treated.
So if you have bleeding gums, bad breath, loose teeth, you've been told you have gum disease or periodontal disease, you're told you may need to have some extractions, get a second opinion with a laser dentist.
Absolutely.
Is that fair to say? You believe that?
I believe that is absolutely. It works.
Now, we should mention, we haven't even mentioned, I know we have like 30 seconds left, but you make special trays that with all natural products to kill this gum disease, to keep it away.
Correct.
Is that right?
Correct.
You call it a PerioProtect.
It's called PerioProtect, and what it involves is using a hydrogen peroxide gel, a slow release, low concentration hydrogen peroxide gel. It's put into a specially made tray such that when you put the tray in your mouth, the hydraulic pressure forces the peroxide gel along the gum line and under the gum line. So it's done on a daily basis in the privacy of your home. It's easy to do, and it gets the bugs. The peroxide will attack the bugs that are the primary meteors of periodontal disease.
Okay, good. We're out of time. Final message, somebody watching this, maybe they have the obvious symptoms of gum disease, but they're putting it off and putting it off. Maybe they're afraid of the dentist. What do you say?
Yeah, come on in. Let's get a look at you. Let's show you or tell you what your options are, and you can have treatment if you desire, or you can't. It's still a free country, so.
And you can be sedated.
For treatment, if you desire, you can be sedated. I'll do the whole mouth at a single appointment. If there's other dentistry that needs to be accomplished that we diagnose and we suggest treating, I can do it at the same time.
All right. I want to thank you for coming on the show. We're going to have you back talking about dental implants. No more dentures.
Appreciate it.
All right,
Appreciate
thanks.
it.
You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.